Clemastine drugs information. Look at this picture, shows that brand generic name Clemastine, drug class antihistamine, first generation antihistamine. Brand names Tevist, Tevist1, Dihist. What is Clemastine? It is a first generation antihistamine particularly used to treat symptoms of allergy such as runny nose, sneezing, itching, watery eyes, and skin rashes. It blocks the effects of histamine, a substance in the body that causes allergic symptoms. Clemastine may also be used for treating and sometimes for cold symptoms. Vital information. Clemastine is effective for treating allergy symptoms and is available over the counter or by prescription. It is known to cause drowsiness and has sedative properties, which are common with first generation antihistamines. Clemastine can be found in different formulations including tablets and syrups. Before taking precautions, medical history. Tell your doctor if you have a history of any of the following: glaucoma, asthma, emphysema, chronic bronchitis, high blood pressure, heart disease or irregular heartbeat, enlarged prostate or urinary retention, thyroid disorders, liver or kidney disease, pregnancy and breastfeeding. Consult a doctor before use as the effects on pregnancy are not fully known. Clemastine may pass into breast milk, so breastfeeding mothers should exercise caution. Age consideration. Children under 6 years and the elderly may be more sensitive to the effects, especially drowsiness or confusion. Drug interactions. Avoid alcohol and other sedatives as Clemastine can enhance the sedative effects. Be cautious if taking medication not cause drowsiness such as muscle relaxants or other antihistamines. How to use. Formulations available in tablet and liquid forms. Administration. Take by mouth with or without food, usually 1 to 2 times daily as directed by your healthcare provider. Follow instructions. Follow the dosage and frequency prescribed on the label by your healthcare professional. Do not exceed the recommended dose. Dosage informations adult and children 12 years and older, typically 1 mg to 2 mg twice daily. Depending on the severity of symptoms, children 6 to 11 years usually 0.5 mg to 1 mg twice daily. Children under 6 years usually only if prescribed by a doctor. Miss dose. If you miss a dose of Clemastine, take it as soon as you remember. If it is almost time for the next dose, skip the missed dose. Do not double up to catch up. Overdose. Symptoms of overdose may include extreme drowsiness, sedation, difficulty breathing, seizures, confusion or hallucinations, coma. What to do if you an overdose is suspected? Seek emergency medical attention immediately. What should avoid? You experience an allergic reaction to Clemastine. Symptoms include rash, itching, swelling, dizziness, or trouble breathing. You have uncontrolled glaucoma. You experience severe drowsiness or impaired cognitive functions affecting daily activities. Side effects. Common side effects include drowsiness or dizziness, dry mouth, nose or throat, blurred vision, constipation, difficulty urinating. Serious side effects: seek immediate medical attention, fast or irregular heartbeat, severe drowsiness or confusion, especially in the elderly, allergic reactions such as rash, itching, swelling, severe dizziness, or trouble breathing. Other drugs will affect. Certain medication can interact with Clemastine and increase the risk of side effects. Other antihistamines combining with other antihistamine can increase drowsiness. CNS depressants, medications such as benzodiazepine, example diazepam, opioids, and sedatives can increase sedative effects. Monoamine oxidase inhibitors combining Clemastine with MAO inhibits can result in dangerously high levels of sedation. Always consult your doctor or pharmacist if you are taking other prescription or over the counter medication to avoid potential drug interactions. Thank you. Have a nice day.